Staff here at the DWIHN Integrated Health Network. If I could have everyone take their seats, we will begin our brief program here momentarily. Thank you so much, everyone, for joining us this morning. I will have our panel members join us here. Mr. Eric Doeh, our President and CEO here at DWIHN, our Honorable Wayne County Executive, Warren Evans, and Mayor Michael Duggan, and obviously Kevin Fisher, Executive Director of NAMI, the National Alliance of Mental Illness. I will turn things over to Eric Doeh, our President and CEO here at DWIHN. Thank you.
Thank you so much, Brooke. Thank you so much to everyone. It is freaking cold out here, so we're not going to keep folks out here long, especially when you have the county executive, the mayor, of course, of Detroit. So glad to see many of my board members here. I was looking to see if my board chair, Ms. Roof, was here, just to extend the thanks to her. We have some of our SUD board members here as well. Our hospital partner in the DMC, Henry Ford. Provider partners are here as well. What a pleasure that this is. You know, when you can get folks out here in this type of weather, you have two things to accomplish. One, you better talk fast so that they can leave, or you better offer some heat. Now, I have neither. Well, I think I'm going to talk a little faster. That way I can get through things for you. This is such a monumental event we have here, you know, and when you talk about leadership, not just on our board, but in our communities, you know, to have the county executive here, Mr. Evans, as well as the mayor of Detroit, Mr. Duggan here as well, is tremendous. And with leadership, you know, comes that important responsibility that you take on. And I remember having this conversation some time ago with our board, as well as with our executive leadership when it comes to inpatient beds. Mental health knows no kind, no type, no race, no economic situation whatsoever. It is just something that affects all of us, whether directly or indirectly. You know, so we've been having this conversation for some time when it comes to number of beds that are available here in Wayne County. And so folks who are a lot smarter than I decided to sit down, you know, along with many members of our board to have this conversation. And there was a realization that we needed well over 288 beds here in Wayne County. And I know that number may not seem like much, but think about it. You know, that's 288 beds that would offer some reprieve for many of our citizens and our law enforcement partners, having, you know, some place to take some of our most vulnerable. But it doesn't stop there, because those are just psychiatric beds we're talking about here. We still need residential beds, you know, and this is where our residential partners come into play. We're still talking about crisis residential and crisis stabilization. That's where, you know, all of our partners in terms of provider partners come into play. But this is also important for our hospital partners too, because, you know, the emergency department are for emergencies, and for many of our folks who sometimes many times go to these emergency departments, there are other places that they could go, and so we hope that this would offer that. What we have here in the background is what used to once be our administrative building, 707 Milwaukee, that now stands as our clinical hub, is going to house, you know, 39 beds for crisis residential and crisis stabilization. And one of the conversations in having with these great leaders here was that, you know, before you are able to ask for something, you have to show folks what you have done lately. And so in this great ask that we have of the state, of our legislators, we wanted to make sure that we were able to put our foot forward first to say, this is what we are doing here at DWIHN. And so as I look at the board and all of the tremendous investment and resources and ability for us to do the things that we've done, this facility here is going to offer much, you know, in terms of crisis residential, as I said, and crisis stabilization, both opportunities for men, women, and children. We think of our larger project that's going to be on 7 Mile that will be coming up here soon, a 60-bed facility there. Again, DWIHN taking the lead, not by its own, of course, but recognizing our partners. and also in our downriver community, what we're going to do there with some of our provider partners. That is extraordinary. But those are just the things that we are working on now and things that are in progress. The bigger picture, though, is that what do you do when you look upon the future? And I remember about a month ago, I was listening to the county executive speak, in terms of the state of the county. And I was so impressed, by all that he spoke of in terms of coming into a situation where it was very bleak and you had to make some decisions, critical decisions. And I thought about this question here: what do you bring to the table to inspire people? And that's what resonated with me, what he brought to the table, not only leadership, but also having the mindset and having that ability to look beyond what was just before us there. And so when you think about the economic growth that's taking place here in Wayne County, it's not by happenstance, it's because of leadership and inspiring leadership. So as we look upon what we were introduced here or asking for, you will hear from Mayor Duggan and you will hear from the county exec as well. It is a tremendous ask, but it is a tremendous need, and so it fits that tremendous ask. And so when we look upon for inpatient facility here, we're talking about a 160-bed facility that is much needed. And it's going to cost about $112 million to make that happen. But it can happen because there is a tremendous need. It will happen because you have leadership here who are willing to support it, and you yourself, as you sit here, and DWIHN, who will put all of our efforts forward to make it happen. That's just one side of it. We also have to think about a residential facility that is not only going to serve, folks within Detroit, but also within the county, period. And this is where there's a model in Boston that they have that really caters towards not only the homeless population, but also folks who are experiencing mental health challenges, physical health needs. And so this will be a $50 million investment, something that will be well needed, and the benefit of that will be tremendous indeed. But as we move forward, whether we're talking about additional crisis residential, additional crisis stabilization, psych beds will also be important here. So in a public-private partnership, you're looking at a 60-bed facility that's going to cost some $60 million to build. Now, these are tremendous asks, but this is a one-time ask here that we have of our legislators. And so to all of our county reps who are here, to all of our local stakeholders who are here, and also our friends in Lansing at the department, we know that this is a tremendous ask, but it is a tremendous need. Now, I went to school to become a lawyer, but I also learned how to count 1, 2, and 3. So these numbers that I've put before you, it all adds up to about $227 million. That is the ask. But it is an ask that is well worth it because it will benefit our citizens here of Wayne County. And of course, imaginary lines are just that. Folks from other communities will benefit from this as well. So with that, Brooke, I believe you gave me hopefully the playbook here so that I know who to call up first. And it is at this time, of course, that I call up one of our inspiring leaders, and of course, our county executive, Mr. Warren Evans. So thank you very much.
Good afternoon, and thank you, Eric. You explained the financial part and what's going forward. I would say this: last year we were here on another announcement under the same tent, and it was 90 degrees. We're out here today, and I'm freezing to death. Eric can always get me to come, but he doesn't tell you it's going to be outdoors until you get there. On a very, very serious note, inpatient mental health beds are critical to Wayne County and its community. If you look at the catchment area that they use to formulate how many inpatient beds you need, the catchment area is not just Wayne County and Detroit. It also covers parts of Oakland and others. The folks who have figured that out, and they're much smarter than I am, say you need to have about 35 beds per 100,000 people. This catchment area has about 28. We're short to begin with, and understand that whoever does that math did it before COVID. So the numbers aren't relevant anyway. We all know that the mental health crisis has spiked significantly since COVID. We know the problems out there, and we know we tend to give lip service to trying to help people, but it's got to be more than lip service. You got to have the beds to be able to deal with it. We see it from every indicator everywhere. The Detroit Police Department, the Wayne County Sheriff's Office, there's no question that officers are seeing far more events that are created by mental health problems. There are far more people committing suicide and being hurt. And by the way, officers aren't exempt from that. We're also seeing officers being traumatized significantly more by the lack of beds. And so it's a critical ingredient that we can't let this opportunity pass. We talk about economic development. We talk about all the other things, bells and whistles, build things, create jobs, do all of. We have to have people to work those jobs. And we don't, in my mind, have any throwaways in our society. So if there are people who have problems that have to be overcome, our job in government is to overcome them or die trying. So I'm very, very committed to the importance of putting the additional beds online. And understand, when they start talking about numbers, just understand it's never enough. Don't dispute the numbers. Add to them, because the problems are so acute that we really have to look at it like that. The ability to keep our workforces strong. I mean, we're seeing it everywhere, and I'm sure the city is seeing the same thing. We are having more city workers with problems. We are seeing more tragic incidents. It's a mental health crisis. COVID didn't do anything but make worse. And we have to understand that. So whatever numbers people talk about in terms of the numbers of beds, just understand it's not enough. And hopefully the commitment of the mayor, myself, Eric, and DWIHN, talking with our legislators, will have enough strength to push this forward. It's not something that we're excited to do. There are always a lot more sexy things we could do with our money, but there's nothing more important that we could do with our money, and that's the fiduciary responsibility that we have, is to protect our citizens. If we don't protect citizens, what are you there for? And what is it we're supposed to do? So I am 100% in support of it. I'm sure the mayor will tell you the same thing in far more detail. Thank you very much. And Eric, thank you for what you do, and hopefully our partnerships continue to grow.
Thank you so much, Mr. Executive. So to Mr. Parker, Ms. Bentuzzi, Mr. McNamara, of course, Mr. Glenn and Dr. Tagg, Dr. Carter, other board members, please, I'm trying to do my best to see you. Thank you so much to Mr. Woods. Thank you so much for our SUD board for representing. I am not going to take too long, of course, to call up our mayor here, Mayor Mike Duggan. And so let me just say one thing quick about Mayor Duggan, right? When you have one of those meetings with Mayor Duggan, this is what happens. You sit there, and you think you have a great idea, right? And then Mayor Duggan says, no, we can do it even better than that. So when you're talking about someone who says to you, you can imagine even greater, this is what he does. So thank you so much, Mr. Mayor. Mike Duggan.
Well, thank you, Eric, and to DWIHN for the great job that you do. But as we know, it's not enough. And part of the problem here has been the way the mental health system has been structured for as long as I've been in government. DWIHN is run by a board, 6 appointed by the county executive, 6 appointed by the mayor. And human nature for the county executive and me is to focus on the things that you're fully responsible for. But with what has happened in the mental health crisis, county executive and I got together and said, the only way we change the mental health system is if we unify behind one plan that we both fight for. And Eric and his team did a great job of fleshing that out. But what you have now is a plan that we are pushing forward together, and I think will make a difference. In my mind, a comprehensive mental health system has 5 pieces. You have your clinics where you can go. If you have arthritis, you can go see the doctor. You can go to one of our FQHCs. If you're having a mental health issue, you need a behavioral health clinic, and DWIHN has done a nice job of setting those up. For people who have chronic but relatively mild conditions, You have permanent supportive housing, a place where you can live, where the mental health services are always available. The city has built hundreds of those, and DWIHN is proposing even more. When, as an individual, you have a crisis, we have crisis centers, 72-hour crisis centers at Receiving, at Santa Grace, at Henry Ford. The partners, excuse me, are here today, but they have to be released in 72 hours. You have people who need more short-term care, can stay for 14 days. And behind you, what you see is DWIHN building those 14-day beds. That's part of a continuum. And then there's the piece for people who have serious conditions, who need secure long-term treatment. And those beds, we know, in 1992, John Engler closed Lafayette Clinic. We've been complaining about it for 30 years. The county executive and I got together and says, how about we stop complaining about it and actually fix the problem? And when DWIHN did the analysis, they concluded we were short 160 long-term treatment beds. And so what does that mean? I tell you what it means in the city of Detroit. We have 1,500 of our residents who have had more than one emergency call for mental health services to their home in the last 3 years. 1,500. We have almost 400 who are making repeated calls, who average 11 calls a year. Almost once a month, either EMS or the police are called to those sites. That's not a comprehensive mental health system. That's a revolving door mental health system. And that's just the truth that we are facing here today and that we want to change. And so what happens too often is we have a tragedy. Barricaded gunman shoots his family, been through the system multiple times, and our elected officials say, we need more mental health services. We've had too many times where we've had a mentally ill person kill a police officer in recent years. Or we've had the opposite happen, where a police officer has killed an individual who'd been through the mental health system repeated times and is still on the street. It isn't fair to the community. It isn't fair to the family who is normally taking care of these individuals, and it's not fair to the patient himself or herself that they aren't getting the right kind of treatment. And so when you look at this, the proposal that DWIHN has put forward is for a comprehensive system, but the key point is we need the 160 long-term secure treatment beds this community has been missing for 30 years. We just do. It's what we need for everybody. And frankly, I'm tired of the speeches that come from elected officials after a tragedy. We don't need your speech after a tragedy. If you're committed to mental health services, we need you to speak at budget time, which is right now in Lansing. And so the reason that the county executive and I have partnered with Eric right now is the state legislature in the next 2 months is going to take up a budget that's going to be in excess of $50 billion. And we're saying there are a lot of important needs in this state. But if you're going to turn your back on this critical funding of the mental health system, you can't be talking about mental health services the next election. It's time to put up or shut up. County executive and I will be in Lansing, and I'm going to push this through. Thank you very much. Eric, back to you.
Kevin Fisher, you have to follow that. Thank you so much, Mr. Mayor. Thank you so much to you know, this is not something that DWIHN and our partners are going to do alone. We will need our provider partners, the people we serve, their families, everyone to be invested in this, because going down to Lansing, as Mr. Parker says, you know, we get on that bus, we're all going. And so, you know, let's get ready to make this happen. But for, you know, where we are at this point, Tricia Stein, Brooke Blackwell, Manny Singla, there are some folks who did some tremendous work to get us to where we are. But next, I would like to call up Kevin Fisher, you know, because certainly when we talk about the advocacy group, there is no one better than Kevin Fisher to call on NAMI. Dr. El Said, I see you in the audience here. Thank you, sir, for gracing us. It's truly a pleasure to work with you. So Kevin Fisher, you're up next, sir.
Sir. Thank you. And you're right, following the mayor is pretty hard because a lot of what he said is what I had to say. It's one thing to have a plan, but it's another to execute. And a plan without execution is nothing more than a dream. It is remarkable that the county, the city, DWIHN, the advocacy community, has come together to support this 4-point plan because it is needed. And as you've heard Commissioner Evans and the mayor say, it's not going to be enough. We know we need more beds. This is a community problem. This isn't just a mental health problem. It's not a law enforcement problem. It's not a judicial problem. This is a community problem. And this takes us steps closer to the world-class crisis continuum system that Wayne County deserves. And I applaud the leadership of Eric and his team at DWIHN, the provider agencies that are part of the services. It's going to take all of us to resolve this situation. And as an advocate and as a person with lived experience, I know firsthand the need for a consistent, strong crisis continuum. But in addition to that, we always have to be proactive. We need to reach people and make them aware of the services that are available prior to a person reaching crisis. That's the key. Let's prevent the crisis. Let's prevent the calls for law enforcement. Let's prevent the emergency room visits. Let's do that. But we need this to be a part of that continuum. So again, Eric, I applaud what DWIHN is doing. This county is taking the leadership role in the state of Michigan, and I call on all legislators to support this and then what's going to come next. So thank you.
Thank you so much, Kevin. You know, and in talking about that plan, you know, first starting with the inpatient beds, as the mayor touched on, and as well as the county executive, crisis services, of course, which would be offered through our care center here, offering crisis residential, crisis stabilization. The third portion of that is our residential facility, where, you know, really leveraging what already exists within the system with our direct care workers in our residential communities. We have well over 3,000 folks who are in that setting, and so imagine transitional homes being part of this continuum would be very beneficial there. And finally, the wellness living. This was the Boston model that I was talking about when it comes to preventative care, you know, that would be offered through that model, a tremendous collaborative that would consist of our physical health partners coming into that space as well. I was told that at this point here that I could take some questions, and I decided I will pass the questions to the county executive and Mr. Mayor. So if folks have any questions in the audience, you know, we will make the PowerPoint presentation that Tricia and Brooke and others put such time into development available so that folks have that. But believe this, it is a tremendous ask indeed, but it is for a tremendous cause and it's worth it. So with that, I'm available to entertain any questions that folks may have. And if you don't, that's okay, because it's cold out here. Sure. Okay, Mr. Mayor, do you want to tackle that? Okay.
The state legislature is debating right now how they're going to spend in excess of $50 billion in a state budget. And we are saying mental health services ought to be a priority, and you should be able to squeeze another $100 or $200 million for that priority if you really believe it. If all of the legislators who as candidates promise to do more for mental health services just vote for this, we're all set. That's why we're here. We're going to Lansing to get it. No, we are asking the state legislature for this coming budget, starts October 1, for funding for these services. That's the point of this. It's the reason for the timing right now, and they're having their appropriation hearings right now, so we think the timing is appropriate. Go ahead.
That's perfect. So the first part of that plan involves our inpatient beds, and so that's where you will have, you know, 60 beds in that particular segment of the plan there. It will call for an investment, obviously, of some dollars, and the investment there would be about $50 million to make that happen. The next portion is when you talk about crisis residential services that will also be offered as a backdrop of that. And so in crisis residential services, when we talk about what we have here behind us, part of it is this plan here, but a more expansive, beds to be offered in that. When the mayor speaks of crisis, I'm sorry, the more adding that 160 beds there, that's where that $112 million will come from for that particular investment. And it doesn't necessarily have to be, a single building, but certainly, one that would accommodate, or a number of them that would accommodate 160 beds or more. The other portion of that is the wellness living. And this is a community center like structure that would offer not only behavioral health, but physical health services, preventative health services, and other things such as housing, job placement, really also looking towards providing services for our homeless population. That's where transitional housing comes into play. And that, of course, will have that investment of $50+ million. Yes. Hello.
Mary had mentioned shutting down of the Lafayette Clinic. Can you please give a little bit of background of what happened then and what has happened since then that has led to today?
Okay, Mr. Mayor, do you want me to take that, or Mr. Yes, the county exec. That's right. That's right.
I think we were all there, and we all know that, at least I feel very strongly that the motivation for closing Lafayette Clinic had nothing to do with the need for mental health beds and everything to do with some other political motives. But what we do know right away is that with the closing, we started having more and more incidents of mental health behaviors acting out in the community. There were years, everybody in here knows, if you drove down Lafayette and stopped at a light, somebody'd come out and wash the windows of your car for you. People who were having behavioral problems as a result of nowhere to go. And the thing I would add to this is it then became a county jail problem. And so there were literally sometimes over 100 acutely ill mental patients housed in the Wayne County jails, in the place least likely to be able to provide any real service that they needed, with people least likely to be trained, to be sensitive to those issues. And so we saw that skyrocket. And of course, in terms of county expenses, jail overcrowding issues, problems occurring in the jail because the appropriate people weren't there to deal with them, we saw significantly. Because as the mayor mentioned, we all knew it when the Lafayette Clinic closed, but for 40 years we've been dealing with a progression of problems that stem from that. And I'm sure COVID had an awful lot to do with this jump-starting the already trending problem since then. So that's really the history of it. I mean, if I was able to quantify the additional expenses to the county that came as a result of that, I think we'd all be staggering at the dollar value. Answer your question.
Thank you, Mr. Executive. Make no mistake about it, we want folks to be out in our communities, but we also recognize that for some of the folks we provide services for, long-term care will be necessary, and so this is what we're offering here in terms of what's been put before you. I'd also like to welcome another of our board member, Ms. Brown, who's in the audience here as well. Any additional questions? When we talk about those psych beds, that's also part of it as well. But also, I would be remiss if I didn't mention the fact that the state is building a facility in Northfield, and that's going to not exactly add additional beds, and that's what I want to be clear about, because sometimes folks think that what we are proposing here is somehow, superfluous. It's not the case. It's simply replacing something that existed before, and this is adding to a need that we desperately have here in Wayne County. My pleasure. All right, thank you, everybody. Thank you so much. All right.